Well, we heard earlier about the shocking numbers of those sick and dying of coronavirus, but it's also taking its toll on the mental health of those looking after them. Many hospital staff treating the sickest patients during the first wave of the coronavirus pandemic were left traumatised by the experience, according to a study by King's College London. Workers at 9 intensive care units in England were asked how they were coping, and of those who took part, 40% reported symptoms of post-traumatic stress disorder. 11% described suffering severe anxiety. 7% had seen their mental health issues develop into problem drinking. 6% said they were experiencing symptoms of severe depression. And 13% reported having frequent thoughts that they'd be better off dead or of hurting themselves. Well, Ameera Sheikh is an intensive care nurse who's working at a hospital in London, and she told 5 News just what it's been like.
You're constantly running on adrenaline. You don't stop to relax. It's very hard to sleep. A lot of my colleagues are having nightmares. They're dealing with their stress in lots of different ways. The coping mechanisms aren't healthy. It's certainly a lot worse since the last wave. We're running out of oxygen in lots of hospitals across the UK, but it's not even just oxygen, it's medications, it's equipment. A lot of colleagues and friends of mine resigned after the first wave because they suffered with so much anxiety and ultimately PTSD. I think as medical staff aren't trained to handle death. It's not our job. We are trained to sustain life. And after what we've seen, the emotional impact it's had on us, it's no wonder why it's led us to this massive staff shortage. Some of us are even having nightmares from what's happening at the moment. I'm extremely worried about patient safety, particularly on the intensive care units, where the nurse-to-patient ratio is meant to be 1-to-1. But as we're taking on more admissions, more patient caseloads for one nurse being either 1-to-2, 1-to-3, 1-to-4, etc. And in some hospitals, it's actually been 1-to-8 patients. With the staff being redeployed from other departments and specialties, they aren't trained in intensive care, and some of them don't have any experience in intensive care anyway. So in addition to looking after our patients, we are also having to train our surge nurses.